The so expensive question, why does healthcare cost so much? We all need it, we all use it, but why is healthcare so expensive? It's a question on many people's minds. The cost of staying healthy or getting better seems to keep going up. This affects everyone, from families to businesses. Let's break down this complex issue. We'll look at the reasons behind these rising costs. Understanding the problem is the first step to finding solutions. This journey into the world of healthcare costs will be eye-opening. It's time to understand why something so essential comes with such a hefty price tag. Feeling the pinch. How rising costs impact everyone. Rising healthcare costs affect everyone. Families struggle to afford medications and treatments. Businesses face higher costs for employee health insurance. Even the government feels the strain on programs like Medicare and Medicaid. Imagine a family. They need to see a doctor for a sudden illness. The cost of the visit, tests, and medications can quickly drain their savings. This happens every day. Businesses face a similar dilemma. Providing health insurance to employees is important, but the rising costs make it a huge expense. This can impact their ability to hire more staff or invest in their business. Governments are also feeling the pressure. They provide healthcare to millions through various programs. As costs rise, it becomes more challenging to fund these programs. This can lead to difficult decisions about where to allocate resources. Everyone is feeling the impact of rising healthcare costs. The paperwork problem, administrative costs in healthcare. One surprising driver of healthcare costs is administrative overhead. This refers to the costs associated with running the healthcare system. Think paperwork, billing, and insurance processing. The U.S. healthcare system is complex. Multiple insurance plans, providers, and regulations create a lot of paperwork. This administrative burden adds significant costs to the system. Imagine a simple doctor's visit. Behind the scenes, there's a flurry of activity. Insurance claims are filed, bills are generated, and payments are processed. All this involves numerous staff and systems, adding to the overall cost. These administrative costs don't directly contribute to patient care, yet they make up a significant portion of healthcare spending. Simplifying administrative processes could potentially save billions of dollars. The price of pills. Understanding pharmaceutical expenses. Medications are essential for treating many health conditions. However, the rising cost of prescription drugs is a major concern. Pharmaceutical companies argue that research and development are expensive. Developing new drugs is a lengthy and costly process. It involves years of research, clinical trials, and regulatory approvals. Pharmaceutical companies often cite these costs to justify high drug prices. However, critics argue that drug prices are often inflated beyond reasonable levels. They point to marketing expenses and profits as contributing factors. The lack of price regulations in the U.S. allows drug companies to set their own prices, leading to higher costs for patients. Finding a balance between encouraging innovation and ensuring affordable drug prices is crucial. This involves exploring alternative pricing models, increasing competition, and improving transparency in drug pricing. Section 5. The cutting-edge technology's impact on healthcare costs. Technological advancements have revolutionized healthcare. From advanced imaging to robotic surgery, technology has led to incredible medical breakthroughs. However, these advancements often come with a hefty price tag. New medical technologies require significant investment in research, development, and implementation. Hospitals and clinics need to purchase expensive equipment and train staff to use them effectively. While these technologies offer tremendous benefits, they also contribute to rising healthcare costs. For example, a single MRI scan can cost thousands of dollars. The challenge lies in finding ways to make these technologies more accessible and affordable without stifling innovation. Exploring cost-effective ways to implement new technologies is crucial. This includes negotiating better prices for equipment, promoting shared resources, and carefully evaluating the cost-effectiveness of new technologies. Section 6. Navigating the maze insurance and its role in rising costs. Health insurance is designed to help people afford healthcare. However, the complexity of the insurance system itself can contribute to rising costs. Multiple payers, complex plans, and administrative burdens add to the overall expense. The U.S. has a mix of public and private insurance programs, each with its own set of rules, regulations, and billing procedures. This fragmented system creates confusion and inefficiency, leading to higher administrative costs. Moreover, insurance companies negotiate prices with healthcare providers. These negotiations are often opaque and can result in varying prices for the same services. This lack of price transparency makes it difficult for consumers to compare costs and make informed decisions. Simplifying the insurance system, improving transparency, and promoting competition could help control costs. Additionally, exploring alternative insurance models and the involvement of health insurance could streamline administration and reduce overhead. Section 7. Playing it safe: defensive medicine and its consequences. Defensive medicine involves ordering unnecessary tests or procedures to avoid lawsuits. This practice can increase healthcare costs without improving outcomes. Doctors may order extra tests to protect themselves from litigation. Defensive medicine adds to healthcare costs without always providing benefits. Fear of litigation leads to higher malpractice insurance premiums. These costs are often passed on to patients. Reforming the malpractice system could help mitigate this issue. Promoting evidence-based medicine and improving doctor-patient communication can reduce defensive medicine. This ensures medical decisions are driven by patient needs, not fear of lawsuits. Section 8. The burden of illness, chronic diseases, and healthcare spending. Chronic diseases such as heart disease, cancer, and diabetes are a major driver of healthcare costs. Managing these conditions often requires ongoing treatment, medications, and specialized care. As the population ages, the prevalence of chronic diseases is increasing. This puts a significant strain on the healthcare system. Treating chronic diseases accounts for a large portion of healthcare spending. Preventing chronic diseases is crucial to controlling healthcare costs. This involves promoting healthy lifestyles, early detection, and effective management programs. Investing in public health initiatives, such as smoking cessation programs and healthy eating campaigns, can help reduce the incidence of chronic diseases. Additionally, focusing on coordinated care models and patient education can improve the management of chronic conditions. Empowering patients to take an active role in their health can lead to better outcomes and potentially reduce the need for expensive interventions. Section 9. Beyond the hospital walls. Socioeconomic factors in health. Healthcare costs are not solely driven by medical factors. Socioeconomic factors such as poverty, lack of education, and access to healthy food and housing can significantly impact health outcomes. People living in poverty often face barriers to accessing quality health care. They may lack health insurance, transportation, or access to healthy food options. This can lead to delayed or inadequate care, resulting in more expensive interventions later on. Addressing these social determinants is crucial to improving health and reducing costs. This involves investing in social programs like affordable housing and food security. Creating a more equitable society is essential. This requires a multi-sectoral approach involving government, community organizations, and healthcare providers working together to address health disparities. Section 10. The government's role, policies, and their influence on costs. Government policies play a significant role in shaping the healthcare system and influencing costs. From regulating insurance companies to funding research, government decisions have a ripple effect on healthcare spending. Medicare and Medicaid, the government-funded healthcare programs, cover a significant portion of the U.S. population. Decisions about reimbursement rates, eligibility criteria, and covered services directly impact healthcare costs. Government policies can also influence the pharmaceutical industry, medical technology, and healthcare workforce. For example, patent laws can impact drug prices, while funding for medical research can drive innovation. Finding the right balance between regulating the healthcare industry, promoting innovation, and ensuring access to affordable care is a complex challenge. It requires careful consideration of the potential consequences of policy decisions on all stakeholders. Section 11. A shared responsibility: finding solutions together. Addressing the issue of rising healthcare costs requires a collaborative effort. It's not just the responsibility of the government, healthcare providers, or insurance companies. Everyone has a role to play in finding solutions. Patients can take an active role in managing their health, seeking preventive care, and making informed decisions about their healthcare. They can also advocate for policies that promote transparency, affordability, and access to quality care. Healthcare providers can focus on delivering value-based care, coordinating services, and reducing unnecessary tests and procedures. They can also work to improve communication with patients and empower them to make informed decisions about their health. Insurance companies can strive for greater transparency in pricing, simplify administrative processes, and explore innovative insurance models that promote efficiency and affordability. They can also play a role in supporting preventive care and chronic disease management programs. Section 12. Your health, your voice. Get informed and get involved. Understanding the factors driving healthcare costs is crucial for informed decision-making. By staying informed about healthcare policy, engaging in discussions, and advocating for change, individuals can contribute to a more sustainable and equitable healthcare system. Numerous resources are available to learn more about healthcare costs and reform efforts. Reputable organizations, government websites, and academic institutions provide valuable information and analysis. Engage with your elected officials, participate in community forums, and join advocacy groups to make your voice heard. Support policies that promote transparency, affordability, and access to quality healthcare for all. The future of healthcare depends on an informed and engaged public. By working together, we can create a healthcare system that is both financially sustainable and delivers the best possible outcomes for everyone.